In high school, as I was struggling with my chemistry class, my teacher told me that one of my problems was that I should stop going back and changing the responses to questions I'd already answered. He said I was overthinking them and that most of the time my gut instinct was correct. What's more, going back and making corrections made me spend too much time on the exam and was creating more anxiety than was really necessary. Fast forward several decades, and it appears that these important questions are still an issue for today's students. A team in the College of Pharmacy at the University of Tennessee Health Science Center believed that students were doing a disservice to themselves by doing exactly what I had done in high school. What's more, they wondered whether implementing restrictions would better prepare them for their board exams, on which they had time limits and are not able to revisit a previously answered question. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. This month, we're talking to the authors of a poster titled Impact of Eliminating Backwards Navigation and Aligning Time Limit on Exams Within a Didactic Curriculum, presented at the July 2025 annual meeting of the American Association of Colleges of Pharmacy. Joining me today are Taylor Littlejohn, a graduate of UTL Science Center and currently a clinical pharmacist with Christ Community Health. Taylor, thank you for joining us.
Hey, thank you for inviting us.
Leslie Hamilton, a professor in the College of Pharmacy. Leslie, welcome.
Thanks, Tom. It's great to be here.
Great to have you. And Don Havrda, Professor and Associate Dean for Academic Affairs and Assessment, also in the College of Pharmacy. And Don, welcome to you.
Always a pleasure.
Great. Well, let's get started. I'm really interested in this poster. Taylor, start us out. Can you briefly summarize your poster and why the topic's important to you?
Absolutely. So our project looked at what happens when you remove backwards navigation on exams and adjust the time limit to better match the NAPLEX and MPJE testing environments. A majority of exams in our didactic curriculum, and really higher ed for that matter, are delivered electronically, which frequently align with licensure exams. The NAPLEX and MPJE, which are the pharmacy licensure exams, they don't allow students to go back to previous questions. They encourage exam takers to pace themselves consistently. We really wanted to see how those changes would affect our third-year pharmacy students' performance, pacing, and perceptions. This topic is really important to me just because I've seen how stressful these exams can be for students. Also, especially since I'm a recent grad, and I definitely know these tests. I'm very familiar with them. I really wanted to know whether aligning our own didactic exams with the licensure conditions can really prepare them better without harming their performance.
It's something I've heard a lot since I've been here at UT Health Science Center, unlike other schools, is that in addition to preparing your students for their professional careers, you're also preparing them for these very important high-stakes licensing exams. And so the idea of how to prepare them for those, and I remember going into COVID, I think we had to talk about, are there other ways to assess students rather than these multiple choice exams? And I remember you saying, Don, you said this was important because we still need to prepare our students for the exams.
Yes, absolutely. Absolutely.
So can you talk a little bit about your findings?
Certainly, yeah. So we found that exam scores essentially stayed the same across 3 years that we compared. So we compared 2022, 2023, and then implemented some changes in 2024. These scores stayed around 85 to 86%. What did change, though, was pacing. So students on the newly implemented changes in the 2024 exams spent less time per question, really about 56 seconds compared to 62 or 64. The survey that we conducted after the fact showed that students initially felt more anxious, but after 6 exams under the new format, they reported their anxiety really decreased. So overall, performance was stable, pacing improved, and students gradually adapted to these new changes.
What about this study surprised you?
Well, honestly, it didn't really surprise me a whole lot. There's been actually a few studies in pharmacy education that has shown that removing backwards navigation doesn't necessarily lower scores, even though students may often feel like it. There hasn't been a lot of research that's done to the extent that we have done across 3 years. There's also been some conflicting studies that show performance may decrease when the exam items are calculations based. However, these were not done in the same format that we usually conduct our exams, which is a composite exam format, which is really just multiple subjects in one exam, which more mimics these licensure examinations. Our students really know the material, so the change didn't affect their ability to answer correctly per se. What it did affect was their experience. They really had to be more decisive on these questions and trust their first instincts, which is really the exact skill they'll need on these licensure examinations.
So I'm interested also in the aspect about the student anxiety. And I can imagine that all of a sudden, if you're telling students you're not going to be able to go back and check again, and you're going to have less time to do this, that the anxiety level increases. But I can also imagine that going into these licensure exams, that all of a sudden realizing for the first time that you can't go backwards, you can have less time, that probably causes anxiety as well. And so I was interested in your survey that over the course of 6 exams, anxiety actually went down, but there's still some students that are really, really anxious. If the exams results weren't that much different and the students are knowing that they're much different, why does that anxiety still exist?
I think that is a fantastic question. And part of it is that pharmacy students are really just known to have higher anxiety. And there have been some studies out there, really more comparing sometimes with medical students, that they may have a higher anxiety than our other health professional students, like medical students. So, regardless of these changes that were made to these exams, some pharmacy students will always have an underlying anxiety. And it's great that there's less anxiety after this change really related to backward navigation, but there's probably a lot of other factors that we, weren't able to capture as the other courses they were taking, maybe upcoming rotations that they were getting nervous about. So I think there is that underlying factor, but probably some other things that we weren't able to capture.
Your survey also has an item that says study strategies adapted. I wonder if you could talk a little bit more about what that means.
Yeah, absolutely. So that item on the survey asked whether students changed how they approach studying or test taking after the new exam format. So interestingly, most students reported that they did not make any major changes. Some said that they might have misusing strategies that they were used to, like flagging or reviewing questions, just mostly because those weren't possible anymore. A few did mention focusing more on anxiety reduction techniques or practicing their pacing throughout the exam. Overall, the majority just adjusted to being more decisive throughout the exam rather than overhauling their entire study habit.
There was another item on your survey that talked about adequate time limits. Can you talk a little bit more about what that was and what the changes tell you?
Absolutely. So that survey question addresses the overall time limit on the exams in their P3 year. And prior to that change in backwards navigation, students really were shown to feel that they had adequate time to complete their exams. However, with the removal of backwards navigation and the reduction in time for the exam, and that really was helping to better match what they see when they get to national licensing exams, some students didn't agree that they had enough time for their exams. However, as they get more adjusted to these changes, we may still see different results in the future. But no matter what, whatever changes we make, some students will probably always want to have more time on their exams.
I think I know the answer to this based on where we've gone so far with this, but scores don't change. Everything stays the same, but there's still anxiety. What's the argument for not going back to allowing students to rewind and take more time?
Well, I think the students would love if we would go back to that, but we do want to mimic what they're going to face when they get to the licensure exams. That's going to be one of the highest stakes and most stressful exams that they're going to take. Um, they did adapt well, as Taylor's study showed, but if they wouldn't, that's where we bring in our colleagues over in student success and have them talk to the students about how to manage their anxiety, how to feel confident in their responses, to answer, respond, and move on to the next question, because that's what they're going to need to do on those the licensing exams, and they have to learn to trust their instincts, just as you were mentioning.
That's good. So you did a study on pharmacy students, and you talk about the fact that very limited number of students, and so things maybe are a little bit more preliminary. Is there anything about the way what you've done that is specific to pharmacy, or could you maybe talk a little bit more how this might be generalizable to any health profession student or anybody taking exams anywhere for that matter?
I really do think that this could apply beyond pharmacy. Uh, any discipline with high stakes computer based exams, nursing, medical students, law students, they could really see similar patterns just because most of these students also take these same computerized examinations. The key takeaway really is that aligning didactic exams with licensure conditions, it doesn't really harm performance, but it does change the student experience. That experience really more mimics what they're going to be taking, and they probably will feel more comfortable taking these exams. That being said, pharmacy students are known to have particularly high levels of test anxiety, so the emotional response might be more pronounced in our group compared to others.
So you've done this study, and you talk a little bit more about still that more work needs to be done. But are there changes that you would recommend to others based on what you've seen so far?
Based on what we've seen so far, there was a lot of pushback initially when we implemented this. We have continued with the same practice in that for all of our pharmacy students, there is no backwards navigation allowed for any type of formative assessments like quizzes, as well as all the assessments are timed. We continued this year, as we did with the prior year, to limit backwards navigation on the big exams for third years. Interestingly, we have had no pushback. I think once they've gotten used to it, they have really appreciated, and the positive responses are that they're not second guessing themselves. So we're continuing to mimic what we did as Taylor showed, and hopefully it'll help our students when they take their boards.
Great. So what are next steps?
I think what Don just mentioned is really important. Sometimes students go between two answers and they end up changing their answer, just kind of like you were mentioning early as well, Tom, to the incorrect one. So limiting their time really helps with that second guessing that they might do and really forces them to make a decision faster and go more with their instinct, which is often the correct answer. As Don mentioned, we are having a new curriculum in the College of Pharmacy in fall 2026. And so we are currently discussing the best ways to assess our students and how to best prepare them for the national licensing exams. And I know some of the results from Taylor's study will help inform decisions that we make in this new curriculum, such as instituting no backwards navigation and timed exams from the beginning of the curriculum versus starting in the third year. So that's just an example of some things that we kind of look forward to implementing in our new curriculum.
So is there another study that's going to come out of this?
Well, I think there's many different things we can look at. So we just put this into place last year. So as we go forward, we can look to see how our students do on their licensing exams to see if this improves their pass rates. So that is one option. I think as we instituted in a new curriculum, one thing we can also look at, and one thing we have learned from this, is that if students ask us if we could get rid of the no backwards navigation, I think we have good evidence to say it's not affecting their performance one way or the other. So we're going to keep our eyes open and see what else we might be able to do with this type of data.
That's very interesting. I look forward to interviewing you when you get that next paper or poster published. So, Dawn, Taylor, Leslie, thank you so much for this time. That's really interesting. I think it's fascinating to hear about how, giving students less options actually in the long run actually helps them. So very interesting. So thank you all for your time. Have a good one.
Thanks for having us today, Tom.
Thank you.
Take care.
And that's this month's episode of Teach Well, Learn Well. I'm Tom Lockyer of the Teach and Learning Center at the University of Tennessee Health Science Center. Until next time.